Hi, I'm Kirishma Mandian, and we're coming to you from Hospital Management Asia 2015 in Yangon, Myanmar. Today, I'm with Mr. Martin Ducharme. He is from Accreditation Canada International. Hi, Mr. Martin. How are you today?
I'm very good, and you?
I'm okay. So, I'll give the audience a brief background about Accreditation Canada International. So, Accreditation Canada International is one of the longest-standing accreditation organizations, and they continuously guide quality improvement and patient safety procedures in more than 25 countries worldwide.
I want to say thank you, first of all, for having us. I'm always very excited to come to HMA every year. I think it's a great event, and it's run by a fantastic team, and it's a great experience every year. So I'm very fortunate to be here again this year, and I'm always eager to learn about all the good things that the hospitals are doing in Asia.
So today I actually have a few questions for you. So the first question actually listed for you is, what solutions does your organization have for hospital managers?
Well, basically ACI offers two things. Number one, we help hospitals validate against international standards the quality of their work and everything that they do on a daily basis. So it's understanding their strengths and also the areas that are requiring development. Second thing that we do, obviously, is to help them improve on those areas. And we do that to make sure that the hospitals always keep the focus on the patient, always make sure that the patient is involved, is informed, and is safe. And that as an organization, we offer the patient the best care that we can give at every step of the way and for the entire duration of their stay. Every CEO out there is going to tell you a good strategy, a good hospital management strategy has basically three elements. You have the people on one side. You hire the best leaders, the best doctors, the nurses with the best training, and people with unique knowledge and unique experience. And at the other end, you have your infrastructure. You have your buildings, you have your equipment, everything that you've purchased so that these people can provide the care. In the middle, and that's the most important box, that's where everything comes together. This is the processes and the daily activities. This is how the people use the building and the equipment to provide care. And this is where ACI works. This is where we work with the hospitals to make sure that everything comes together, because if it doesn't, it's a disaster for the patient. We do this basically through different services. So we offer an accreditation program. We offer advisory services, coaching, training. Basically, it's a complete package to make sure that the hospitals are moving towards something greater, something better for the patients, that they are a better version of themselves year after year. And they do this for the patients, and they do this also for their community. And for me, for yourself, and for a lot of people, I mean, it can be a stressful experience to go to the hospital. So I think healthcare providers, our role, the most important thing that we have to do is to make sure that those patients feel reassured, that they feel that they're in good hands. It's about the patient experience. It's about building trust. We want to build trust between the physician and the patient. We want to build trust between the hospital and the community. So this is what we do. We work with the hospitals to understand what they do well and where they need to improve. And then we give them all the services that they need so that they can do better year after year and build that reputation and build that trust with the people.
So for now, what would be the latest service that your organization has for hospitals?
Well, we continue to improve. If you're not improving, if you're not learning all the time, then you're regressing. So we have currently the largest library of standards for any accreditation program in the world, with over 75 service-specific standards. And we continue to add new standards every year just to make the program, extend the coverage of the program. So recently into standalone pharmacies, into air ambulance, emergency ground transportation, health systems, which is one of our specialties. We also are now working to certify centers of excellence in programs like stroke and trauma, and looking into new areas like diabetes and cardiac, the programs that cost a lot of money, that are high risk, that are high volume for the hospitals. And so we really help them optimize those services to a point where they're at a level of centers of excellence. We are very proud also to continue to lead the way in accreditation programs in terms of technology. So we have online portals for the organizations where they can access all the standards and all the training that they need, and also conduct self-assessments for each department. So helping the hospital run questionnaires, run analysis, so that they can involve all the departments in really having a big picture of what's going on in the hospital. Everything is done online, and then it develops a quality roadmap. So it's a dynamic roadmap that basically tells you what are your priorities, where do you need to work, what do you need to absolutely improve now, and what can actually wait a little bit. So all of this is automated, and we provide that on the internet or on iPads, on all kinds of apps, making it mobile and convenient for everyone. And the last thing that we do, and this is probably the thing that we take the most pride in it's that we've started to collaborate at a national level with each country in Asia, in the Middle East, in Europe, South America. But what we do is we offer them all the standards that we have, the programs and services that we have, in partnership with the Ministries of Health and with the local accreditation bodies. And this kind of collaboration, basically, it's to offer everything that we know and everything that we have locally in the country, in the right language, because we don't pretend to speak all the languages in the world, but in the right language, with the software in the right language, with the guidelines and the standards that are adapted to the national reality, so that when we're talking about certain requirements for infrastructure, that we meet the requirements of the country and we're not imposing some North American model on another country. And the idea behind this partnership and strengthening accreditation bodies in other countries is that if we continue to do it from Canada as ACI, it's a model that has its limits. It's also very expensive. It's not sustainable. And the day that you make it not sustainable and not affordable, it means that not everyone can have access to it. So we want to be able to make sure that every hospital in the country, every primary care clinic, every ambulatory care center can have access to international standards and international expertise. Because that's the only way that you're going to be able to make a difference in the healthcare system. If you accredit 20 hospitals, 20 private hospitals out of 200 in the country, you make no difference on the healthcare system. It's the day you do 200 out of 200 that actually things are moving in the right direction. So we take a lot of pride in these national collaborations in almost 10 countries now.
Sounds really good. Interesting. So my last question would be, what's your USP for hospital clients?
One thing that we do with the program, and that a lot of hospitals like, is that we're known for what we call the required organizational practices, the ROPs. The World Health Organization also refers to them that way. Essentially, our program is designed in a way that allows hospitals to easily identify the criteria that are mandatory. These are the foundations of what needs to happen in a hospital. The high priority criteria after that, and everything that's just a regular criteria. It's very easy for them to understand that what's critical and that they really need to achieve, and what is like an extra the day that they want to become maybe the best in their region or the best in their country. So that's one way that we've designed the program. The other thing that's very interesting is we've developed the program to have 3 levels of recognition. So you can get accredited and recognize 3 levels of performance. So we start at the most basic level, which is the gold level. This is the basic one. This is where organizations start with their accreditation. And from there, we coach them and we work with them so that they get to the platinum level and the diamond level. Now, why does that matter? Well, hospitals themselves, they don't want to all be on the same level. They want to be able to differentiate themselves. They put a lot of effort in distinguishing themselves, and they want to be able to say that that their efforts are rewarded, and that they are able to see that they are progressing from one cycle to another. That if they were to go level, they've moved on to the platinum, and that everyone's moving in the right direction. It's a good validation to have. Second thing is, as a country, you want to be able to know which hospitals are doing well and which ones are still in the early stages. And for people like you and I, as patients, we also want to know if my hospital is improving or if they've been at the same level every year.
Yeah.
I want to be able to see that large hospital is actually in a category of their own compared to the others or not, and like just really see that difference. So those 3 levels are very interesting. And another thing that we do very differently is that we've built our program to have all the standards very specific to each services in the hospital. The idea is that we didn't want to have a hospital accreditation program that's like the same program for everyone. Because if you're a very large hospital in Yangon, or if you're just an orthopedic surgeon, I say just, but if you're a specialized hospital that only does orthopedic surgery, you don't want to see criteria around like obstetrics and gastroenterology and everything else. You do orthopedic surgery. By building our program through different standards for each services, the hospital, when they signed up, they select each services that they offer, and they only get the standards that pertain to themselves, as opposed to getting a big book that maybe has criteria that doesn't appeal to them and that doesn't speak to their staff. We don't want to waste anyone's time, so down to a point, customized personal experience. And the last thing I would say is that we do this, we encourage hospitals to involve the patients and to work with their communities, and in a very collaborative way. And we want to do the same things with the hospitals ourselves. So when they sign up for a program, we offer them a dedicated advisor. That's a coach. That person works with them on understanding the standards and how do you actually improve for what's required. We also offer them assign them a project manager who only works with them in helping them understand what are the different steps and what needs to happen at what time. These 2 things is basically to make sure that the hospital doesn't have to figure it out on its own. It's very difficult when you don't know what it's supposed to look like and how long each step is supposed to take, and trying to read a standard and try to understand what ACI is asking of you. So we do this, and we do this internally. And that matters because for a hospital, you don't want to rely on external services, external consultants and things like that, because it's a variable cost that becomes a hidden cost in the project. You do accreditation, then you realize you spend a lot of money on external consultants. Well, directors of finance love this exercise because it allows them to know exactly how much the project is going to cost. For the CEO and the quality director, they know exactly that in the project plan that we give them, everything is there. There are not going to be any surprises, any additional costs. The way it's designed is to make sure that they don't rely on anything else but the relationship that they have with ACI. And we work with them before the accreditation, during the accreditation, and even after. It's supposed to be a long journey together. It's not supposed to be something you work together to get the paper and getting on the wall. Paper on the wall is just a certificate. It's like getting a degree in university and never using it. You want to continue to work after that and build on the knowledge that you have and the experience you've acquired. So we take a lot of pride in creating this package for the hospitals, this all-inclusive packages, and it makes a lot of sense. And it's helped us make a difference in over 6,000 organizations in the world so far, and we're very proud of that, of the difference we've been able to make.
So your services seems very hands-on. So I think that's something that hospitals will really be thankful for.
It's something we're very happy to come and offer as an alternative now in Asia. I think it's worth considering. There's a lot of great programs out there, and it's important for all organizations to find something that really works for them, whether it's with ACI or somebody else. But we really have a package that works for everyone, no matter if you're public or private, and of all sizes.
I think that's all the time we have today. So thank you very much for watching and tuning in to Hospital Management Asia VIP interview.
Thank you.
Thank you so much.